Indigenous Australians make up 3% of the total Australian population, and this population tends to have much poorer health than the rest of Australia. 1 out of 3 Indigenous Australian children and 2 out of 3 Indigenous adults are overweight or obese. Indigenous Australians generally have a lower socio-economic status than other Australians, meaning on a population level they have lower income and lower rates of education and employment. Not only will low socio-economic status reduce the amount of money that can be spent on healthy food that prevents weight gain, it can also lead to less knowledge on what these foods are, causing people to instead opt for cheap and unhealthy fast food. A large amount of Indigenous Australians live in rural and remote areas, which creates further difficulty to access healthy food. Due to transport costs, food is even more expensive. People in these areas also tend to be less physically active than those in urban areas. Obese Indigenous Australians face discrimination based on both their weight and their nationality, occurring in the workplace, healthcare facilities, schools, and even in a person's own home. Stigma can also be commonly found in mass media. Stigma is a sign of discredit or disgrace that causes public disapproval and takes away from character and reputation. Discrimination is the poor treatment based on this prejudice. Victims of discrimination and stigma are often at high risk of developing mental illness, such as depression and anxiety, and this is due to feelings of marginalization and shame. Obesity is highly preventable, therefore obese individuals are often blamed for their weight. This is why weight stigmatization is often seen as justified, along with the idea that it's a method to motivate individuals to adopt healthier lifestyles. However, it often has the opposite effect, as individuals are less likely to participate in activities if they don't feel comfortable and accepted. When demonstrated in healthcare settings, weight stigma can reduce participation in obesity-related interventions, and when demonstrated in schools, children may be repelled from participating in physical activities. Negative attitudes towards obese patients are expressed by healthcare providers, resonating from the view that the patients are dishonest about their behaviours, lazy, and lacking discipline. Patients often feel as if they're not taken seriously, and because of this are reluctant to discuss their weight concerns with providers, limiting their opportunities for healthcare. Indigenous Australians also face racial stigma. Based on their race, they are often perceived by the public as violent, uneducated, and welfare reliant. Healthcare systems are social institutions that are based around the culture of the population they serve. In Australian healthcare systems, Indigenous and non-Indigenous cultures clash. Based around Anglo-Australian cultures, there is lack of recognition of cultural differences, and often lack of respect towards Indigenous values due to racial stigmatisation. The Indigenous population has lost trust in healthcare services, which often fail to be culturally appropriate, and this has an adverse effect on participation in obesity programs. Stigma is not only received externally, but can originate within. Obese Indigenous individuals may experience feelings of unworthiness due to their body size or race. This may relate especially to children, as it's common for children to compare themselves to their peers they surround themselves with, especially during this major stage of self-development. To improve participation in health interventions, there is a need for increased public awareness and education about the complex causes of obesity that are beyond an individual's control. Greater awareness and concern for mutuality and respect within healthcare settings will assist in rebuilding trust in health institutions. Using a strength-based approach between patient and provider, healthcare professionals could attend workshop sessions with Indigenous Australians struggling with obesity to discuss ways that poor treatment and programs and interventions may be addressed, and work in cooperation to design appropriate interventions that will enhance community participation. This will demonstrate respect for cultural needs and a reduction in the stigma against this group. For children, destigmatizing programs could be implemented in schools, educating about the complexity of obesity and how rape-related and racial jokes are damaging to their peers.